Good morning, everyone, and welcome to NAMI Tennessee's Advocacy Series. This is part of our annual Day on the Hill event for 2022, except we're not physically at the Hill this year due to some continuing concerns about COVID and the pandemic, and we wanted to make sure everybody felt comfortable and safe. So this day, March 1st, kicks off a whole month-long series of events that we have to engage you in advocacy, to make you feel more comfortable talking about mental health issues and learn how you can take your experience and your story about your mental health journey and use that for change. Talk to policymakers, talk to legislators. So we're so happy that you're here today. Before we started, I asked people to put in the chat box why they're here. And what I'm seeing is a lot of passion, a lot of interest in how to become an advocate. So you're in the right place. Our series continues tomorrow with the actual advocacy training, how to tell your story effectively. March 8th will be at 4 p.m. Central, will be an hour-long educational webinar on the new 988 hotline that's coming in for mental health crises. I want to see in the chat box how many of you have heard about or know about the 988 hotline. Just put a yes or no. Yes. Lots of yeses. Okay. Good. Good. Yeah, a few no's. Yeah, this is a really important thing that's going to be going on with the 988 hotline. So we're going to be talking about that on March 8th. On March 15th, we're going to be talking about school-based mental health and what's going on with the legislature and efforts to get mental health services to kids in schools. And then finally, on the 22nd, we will have an advocacy update on what's going on at the Capitol and what you need to know as a mental health advocate. So I'm going to see if Jeff Flayden is here. Jeff, if you could unmute yourself and turn your camera on. Okay, I'm not seeing that Jeff is here. Okay, so I'm going to go ahead and start with my presentation. And the title of this presentation is Advocacy in Challenging Times. And I think it's safe to say that the past couple of years have been very challenging for all of us with the pandemic, with politics. It sort of makes you wonder, like, is it all worth it? Is being an advocate and stepping out and stepping up even worth it? And I'm here to tell you that, yes, it is. And I put a lot of thought into this because I want to be as inspiring as possible for you all. And that's why this theme for our advocacy series is inspiration, imagination, and action. So today we're focused on the inspiration and imagination. You're going to hear from some great speakers, Commissioner Williams from the Department of Mental Health and Substance Abuse Services. She's very inspiring. And then we'll also hear from the Secretary of State, Trey Hargett, who will share a little bit about his experience when he was a legislator being lobbied or talking to advocates about mental health issues. So I'm going to go ahead and share my screen. Let's see, share screen. Okay. Advocacy in challenging times. So what I'm going to do is I'm going to give you some practical tips on things to remember if you ever feel that you're fed up with politics, you don't want any part of it. I'd like to see a show of hands in the chat box. How many of you are really tired of hearing about stuff in the news? I don't know if you can see the chat box on your screen. I know me personally, it's really tough to, it's part of my job. I have to keep up with politics, and sometimes it gets really difficult. It gets me down, but there are just some certain principles that I have to remember about being an advocate. So here's what I would like to share with you all. Tip number one, mental health is not a conservative or liberal issue. So don't get caught up in it. Many times we see in the news, Republicans bashing Democrats, Democrats bashing Republicans, the media getting in on it. And it's done to create controversy because the idea is to keep people focused on the news and what they're doing in DC or Nashville or wherever. And to those of us on the outside, it's just so much. It's a lot of infighting. It's a lot of negativity. But when it comes to mental health, it really doesn't matter because mental health affects people, whether they're blue or red, Democrat or Republican, Black or white, rich or poor, educated, uneducated. As we know, mental health cuts across all demographics. And that's really important to remember. What we're finding is that Republicans and Democrats will come together and vote the same way on mental health legislation. Our bill last year to create more transparency in Tennessee about health plans and how they cover and provide care for substance use disorder and mental illness, that bill passed unanimously, Democrats and Republicans. So again, don't get caught up in the news about who's right, who's wrong. Keep your focus on, on the mental health issue. Focus on the outcome, not the personalities. Now, I'm pretty sure that seeing those two faces is going to evoke some kind of emotion one way or the other from most of you. And if not, well, then you're in a good place. And the idea, again, to build off tip number one, don't focus on the personalities. Imagine that the person in this picture, the one that you like the least, imagine that he has funding, millions and millions of dollars of funding for mental health for your community. What would you do? Would you let a personality get in the way? You might not agree with everything the president does. You don't even have to like that person. But when we focus on mental health, we need to rise above the personalities and the partisan politics and focus on what the outcome is. And I think we can all agree that the outcome is access to mental health services, diverting people from criminal justice. Those are the kind of things that are more important than the personalities. So here's tip number 3, always take the high road. Now, this is not a popular place to be sometimes because it's not easy to take the high road. And by taking the high road, it means that you don't engage in public controversy on Facebook, on social media, in the media, no name calling, no blaming, no accusations. And that's tough in politics. John Maxwell wrote an entire book about this. And I love this quote: by taking the high road, people drain animosity and bitterness out of relationships, serving to keep them open and productive. And we're going to hear from Ron Heady here in a few minutes about this very thing and about why it's important to do that. Tip number 4, never say never. When you're an advocate, it can be disheartening if your bill doesn't pass. I've worked on a piece of legislation that was that took 22 years to pass, 22 years. And it can get disheartening. So never say never. And I'm curious if anybody recognizes these kids or what this issue is. If you can put in the chat box, I'm going to give you a hint. It has to do with kids and it had to do with a toxic waste dump. Anybody have any ideas? This is Love Canal. And you might remember from 1978, for those of you who are my age or older, it was huge national news. And it This Love Canal issue is probably one of the greatest grassroots advocacy campaigns ever accomplished. And this was a long time ago. And it started with a 27-year-old mom, Lois Gibbs, and she discovered that her 5-year-old son, Michael, was attending an elementary school next to a 20,000-ton toxic chemical dump in Niagara Falls. She questioned the school board, and the town, and they just dismissed her as a concerned mom with an ill child. She fought for 2 years. She organized her neighbors to form the Love Canal Homeowners Association, and she lobbied the federal government to have the whole community relocated. They faced opposition from a major chemical manufacturer, local, state, and federal government. And with their research, they found that the chemicals leaking from the dump ground, like dioxin, was the cause of birth defects, miscarriages, and cancer that was really high in that community. So Lois's efforts led to a very long battle and a 2-year battle. And in 1980, President Jimmy Carter delivered an emergency declaration and moved 900 families away from the hazardous area. This makes it one of the biggest grassroots efforts, advocacy efforts. So never say never. A couple of things just to bring it back home a bit. They never said a lottery would pass in Tennessee. Legislators 20 years ago said, oh no, Tennessee's never going to have a lottery. Today, that lottery funds millions and millions of dollars into our education system. And they said there wasn't enough money to help kids with mental illness. And 4 moms created an organization called NAMI. So never say never. And finally, I want to just point out that, remember, challenging times bring us change. This is from the civil rights movement in 1964. And the picture on the left is the protest around the George Floyd killing. These changes brought us the Civil Rights Act of 1964. These changes brought us a new way to look at how minorities are treated in this country. That is change. So when you get bogged down or feel overwhelmed by all the changes and things going on, challenges bring change. Look what's going on right now, this day in the world. There are countries uniting in a way that I have never seen before. And these pictures are from England. Those are the protests in Berlin, New York Times, and I think that last one is Brussels. But change is happening. Change is happening with this issue in Ukraine. And finally, change is happening with mental health. Our children are facing high levels of depression and anxiety, to the point that the American Pediatric Association and 2 other organizations declared a public health emergency. There are many people who are saying the results of the pandemic will lead to the onset of a new crisis for mental health. We have huge opportunities. With challenge comes change, and we're in the right place. So I just want to say that please be inspired and don't give up hope. Imagine what is possible. So thank you. We have now with us Jeff Flayden, who is the NAMI Tennessee Executive Director. Jeff, can you unmute and turn your camera on?
I am unmuted, but it says the host has turned off video, so I don't know how to do that.
Okay.
I click on the button. So, but if you don't see me, it's better because I've been told I have a voice for face for radio. How about that?
That's funny.
So first of all, I apologize to not be here at the beginning. I had some technical difficulties, but was with you in spirit. And I think I'm not introducing the commissioner yet, so this is my hello. I guess it's amazing to see people here. I think the grassroots nature of NAMI is special. And we are different than any other mental health organization that I know about, because most of what we do is volunteers like yourselves and people that are here. And we want to just give support and assistance for you to carry your message, that we want quality, accessible, affordable mental health and behavioral healthcare services. The work that Alisa is doing and Bill Dobbins and all of you makes a difference, that people make a difference. Legislators need to know that it's real people that we're talking about that are getting served when we talk about mental health crisis, 988, 10 care, mental health centers, walk-in centers, all these kind of things. So really just thank you all for being here. Let us help you. People say that raising money is hard and they don't like to ask for money. I've heard that in the nonprofit world, but talking to legislators is a little daunting for some people as well, but they're there to serve us. And I thank all of you for being here to do that. So back to you, Alisa.
Great. Thanks, Jeff. Thanks for being here. Next, I want to see, oh, there's Jeff.
It worked again, so I'm back. Yeah.
Great. I'm going to see if Ron Heady is here.
He is.
Oh, Ron. Hi, Ron.
Good morning.
Thank you so much for being here. I'm going to have you introduce yourself to the group.
Okay. First of all, I just want to thank you all for the opportunity to speak with you today. I'm going to tell you a little bit about an organization that I work with called Braver Angels. And I need to alert you that I'm going to both support and probably end up repeating many of the things that Alisa said in her opening remarks, because it was very encouraging to me to hear how much we have in common. I'm here representing the Nashville Alliance of Braver Angels, which is a national organization that began in 2016 after the presidential election. Lisa referred to those as challenging times. The founders of Braver Angels were reacting to what they called the rough and tumble of American politics, which is, of course, historical, but it had reached a new level. They feared that politics had become demonizing and dehumanizing. And the worst part they saw was that these techniques were spilling over from just politics and threatening, actually, the goodwill of our society. So the problem had been growing for some time, but it reached a point where we no longer saw our political opponents as simply wrong or misguided or misinformed, but actually as enemies who had to be defeated. And more, we began to see them as people who were in fact ill-intentioned and maybe just plain evil. So when Alisa brought up the pictures of two political figures not just a few seconds ago, it was pretty clear that those emotions are very strong. And that is what Braver Angels was founded to counteract. The three founders all had backgrounds in working with families and communities. And they conducted an experiment to see if Americans could still disagree respectfully and perhaps come to find some common ground. So that experiment was now called a Red Blue Workshop. And it was the genesis of the organization that now has over 10,000 members and local alliances in 42 states. So the basic idea was to provide workshops that create safe and secure settings for people who think and believe differently to actually engage in respectful civil conversations about their positions, why they came to believe what they believed. And there are three principles that guide all of the work that we do. First is the rule of balance. At every level, from the national level down to our Nashville local alliance, there must be, in order for there to be a legitimate group, a red and a blue leader. And even as much as possible, we extend this into the workshop settings themselves. Alisa showed the signposts of the liberal and conservative. Braver Angels uses the terms red and blue rather than either liberal or conservative or Republican or Democrat. But in a sense, red is those people who lean toward primarily the traditional conservative view of politics. And the blues are the ones who are more inclined to believe the more liberal philosophy. So here in Nashville, we have a liberal and a conservative co-chair. At the state level, the same is true, plus a deputy. And that deputy is my wife, Lynn, who was scheduled to be here with you today. And she wants me to, first of all, convey her thanks for the invitation and her regret for not being able to be here. But this balance is essential because it models the Braver Angels approach, acknowledging that people often disagree. But despite those disparate views, we can, and in fact, we should meet together and attempt to find a way to bridge that divide. The second principle is that we always seek common ground to determine if there is some starting point from which we can move forward. It's not about persuading or changing minds or proselytizing, although sometimes people do change their minds. And it's also not about compromising. We never ask anyone to give up anything or to agree to something they don't really believe in. The goal is understanding that can only result when people of different perspectives treat one another with honesty and respect, agree to disagree accurately, and learn from one another. Sometimes there's not much common ground to be found, but I like to think of this as applying the physician's Hippocratic Oath in a different context. When we can bring people together so that they learn from one another and reach a mutual understanding of our shared humanity, we have done no harm. The third principle is that the real work is done on the ground at the local level, primarily by volunteers working with fellow citizens committed to achieving shared values. COVID interfered with that work, of course, and much of the Braver Angels activity turned to the internet and Zoom, similar to the way we have convened and are working together today. But the work ethic is always citizen leadership, focused on continually searching for ways to salvage and to bolster our respect for one another as human beings and citizens. So after this probably too long introduction to Braver Angels, you're probably wondering, what does Braver Angels have to do with NAMI? Well, first of all, we have a similar mission and vision. Braver Angels brings Americans together to bridge the partisan divide and strengthen our democratic republic. And this mission is based on a vision of a society where individuals honor and respect one another. NAMI envisions a compassionate society with various opportunities for recovery and inclusion for citizens with mental illnesses. So we converge on our belief that compassion is built on a foundation of respect and honoring one another. Second, we both rely on the work of volunteers, primarily, people who are committed to enhancing the emotional environment in which they live and work. Your organization is one based in advocacy for a specific group of citizens, and ours has grown from a somewhat more abstract concept, but based on the concern that politics has seeped into almost every part of our society. And it has created an atmosphere of enmity and disregard for our fellow citizens. Alisa said earlier that we should be sure to try to focus on the outcome, not the personality, and don't get caught in that partisan approach to every single issue. That is one of the things that we are attempting to promote also. Third, we're both committed to effective communication in order to achieve our goals. And the primary and overriding purpose of every Braver Angels workshop is twofold. First of all, we strengthen our speaking and listening skills so that we can leave a conversation feeling, first of all, that the other person felt heard and understood, but that we can leave that conversation feeling that we too have been heard and understood. And all of the workshops focus on skills that are not new to any one of you, but as all of you who are musicians or athletes recognize, we sometimes need to focus on specific skills, pull them out, practice them, and then take them out and use them again. So, as important as these skills are for the so-called political and issue-based conversations and discussions, they're just as important, if not more so, for focused and defined conversations around the specific area which you all are using as the basis of your advocacy. We found in our workshops that the overwhelming majority of participants leave commenting that we're not so far apart as we thought, or that there's more common ground than we realized, and they're eager to take these skills, which are not new, but they've practiced them and apply them in other realms that are important to them. One of we leave people with two messages. Go into these conversations assuming good intent. Alisa referred to this earlier, in that we have to go in assuming that we all have the best interests of our society, our country, our city, and our fellow citizens in as our primary goal. We're just going about it in different ways. We also encourage people, don't attack someone else's motives. Focus on the content. Very similar to one of Elisa's opening comments too, about focus on the outcome. Don't get caught up in what's happening. I noticed that the title of this section was staying active or staying positive in politics. And I just want to close by saying, I became involved in this work because I was dejected with the national picture. I realized I had so little influence or control over things that were happening at that level. And I wanted to become involved in something that was much closer to home. And as a former teacher, I felt that being able to help people with these kinds of conversations was an appropriate way for me to become a part of all of this. And I have no regrets for doing so. You all can learn about Braver Angels just by going to the website, braverangels.org. And you'll find there a listing of all the different activities that are available. And we are beginning to open up and have face-to-face meetings back in Nashville again. In fact, that's where we met Alisa at a bonfire that we had in October. It was not political in any way at all. It was a social gathering, but we invited people from different perspectives just to have an opportunity to come together and realize we can too still talk to one another. Our communication skills would be a good foundation for the kind of storytelling and advocacy training that you're going to have tomorrow, because it's often difficult just to start off telling your own story. There's a little acronym that we use in some of our training called LAP. That is listen, acknowledge what you have heard your conversation partner say, and that helps you really listen instead of formulating all of your responses and arguments about why that person is wrong. Before you get to your own perspective, there is a little step called the pivot. Your partner may not quite be ready to hear what you have to say. And so rather than start on something that is not going to be productive, you can look for the signals that maybe it's okay for me to say my part too. As Alisa said earlier, never give up. Don't, just because that person isn't ready yet, there may be another opportunity, and seek that one too. Thank you so much. Anything else?
Oh, Ron, that was great. Thank you. Yes, when I went to the bonfire, it was really great because it turned out that I ran into so many people I knew. There was actually a woman from another organization who had a different view on a bill that NAMI Tennessee had. And I was able to sit and talk with her at the bonfire. And then I
Mhm.
saw Joey, the legislative aide for Representative Manis, who was
Right.
here last year speaking with us. And it was just so nice. You know, they had different views than I did on different things. And but it didn't matter. We were just there sharing a nice evening.
Right. Yes.
Yeah.
Good. As a
Yeah.
matter of fact, tomorrow morning, my co-chair is going to meet with a delegate of the Republican legislators to begin this conversation, which Braver Angels has called Braver Politics, actually trying to engage the elected representatives in these kinds of conversations, which we've been very successful in convincing ordinary citizens to have. But can't we promote civility and good conversation at that level too? So.
Yes. And through getting involved with your organization, I also learned a couple things about myself. I first learned of Braver Angels in Lynn through a presentation she did. I think it's the League of Women Voters for the Women's Political Collaborative here in Nashville. And she had us do a quiz, and we had to answer how we perceive ourselves as listening to other people. And the idea was to really gauge how open-minded you think that you are and how willing you were to listen to the other side. Mm-hmm. And I was shocked. Apparently I'm not as willing as I thought I was. And what I loved about that is it helped me reevaluate myself and how I approach other people who don't have the same view as the legislation that I'm working on. So, and then from what I understand, you have an affiliate in East Tennessee and an affiliate here in Nashville, right?
Yes.
Okay,
yes, and
great.
We're working to create one in Memphis in the middle of this month. We're going there to present, first of all, an introduction to the general public and also one at a Rotary Club. And we're going to conduct one of our workshops called Family and Politics for a group one evening. Family and Politics as well as another workshop called Depolarizing Within help us. They're very introspective, and they help us, first of all, as you just said, figure out when are we sometimes the ones who are stoking that fire. Especially when we're with people who think like we do. It's so easy to jump on the bandwagon and just to get that parade moving right down the street. And in fact, we could be doing some things within our own group to be a little bit more moderate, more temperate, or as you said, a little bit more open-minded to respecting views from a different perspective. The Family and Politics one is focused on a lot of people have become very divided in their families as politics has crept into even that level of our society. And so it just focuses again on communicating more effectively with the people who are closest to us.
Great. Thank you so much. This has been really interesting and helpful. I put in the chat box the link to the organization, and I'm hoping that people can be directed there and find you and Braver Angels Tennessee. So
thanks a lot.
Thank you again. Thank you. It's nice to have you here.
Thank you.
So we're going to pause for a minute and take a really quick survey. We want to gauge where you are now with your thoughts and feelings about advocacy. And Roger, do you have that survey that you can post? And Jeff Fladen, our executive director, is getting ready to introduce our next speaker.
You and I are logged into the same account, and it is not allowing me to pull that poll up. I will work while we have our guest.
Okay, great. That sounds good. Jeff, do you want to go ahead and introduce the commissioner?
I certainly would, and it was nice to hear from Ron, and I really like the idea that we do want the same things, even if sometimes we may not agree on how to get there. So we need to work together always. I have the privilege to introduce Marie Williams, and I have her impressive bio here, which I'm only going to tell you a little bit about her from the bio because I'd really rather speak from my heart about Commissioner Marie Williams. But first, she is a social worker by training, an LCSW, reappointed as Commissioner of the Tennessee Department of Mental Health and Substance Abuse Services by Governor Bill Lee on January 19th, 2019. And she was initially appointed by Governor Bill Haslam. And the other thing I'll say about her work, besides she's done amazing things, is that she came from the bottom up. This is not a political appointee. And sometimes when you get into commissioners of governments, you get a political appointee. And that is not what we have with this commissioner who worked in Memphis, had engagement with crisis and mental health, worked her way up through the department, has had a really distinguished career, all kind of awards. But I really want to say more about her personally. I don't know a better advocate for mental health in Tennessee than Commissioner Marie Williams. I mean, yes, she has a job, she's paid as a commissioner, but you can tell when you spend time with her, the deep concern and feeling and compassion for the mission, for individuals impacted by behavioral health disorders, but also for caregivers and family members. And I really want to salute her for her leadership in helping to share the importance of this mission with our legislature and with our current and previous governor. She has brought an impressive amount of new dollars into our system, including expansion of the safety net and safety net for children, and walk-in centers, and beefing up crisis, and making sure we have a robust, publicly funded system for substance use disorders and for mental health. We are so really excited about the work that we get to do with her, that we're actually honoring her with our Vision of Hope Award, which you'll hear later about. In May, we have an opportunity to do that and have a special night coming that'll be virtual, meaning much more affordable without that real expensive country club dinner. But back to the point here, she really has asked for a whole lot of new investment into Tennessee for behavioral health care. And I'll say that there's competition for dollars. Dollars and resources are not infinite. She has to work with the governor, and other needs like education, lots of needs are balanced, older adults, many things. She's done a great job. I don't know anyone else that would be a better commissioner, and I actually know some other commissioners from other states. So, and she answers questions. So last year, I recall that she took some time for Q&A, and she really just answered any kind of question. She wants to hear if people are not getting their needs met and fix the gaps. So Marie, thank you for being here.
Hey, Jeff, thank you so much for the very, very kind introduction. As you guys know, I don't do any of this alone. I have an amazing team, many of whom are on your conference Zoom today. Matt Yancey being my Deputy Commissioner of Behavioral Health Services. I mean, he's been so incredible of leading us through the COVID pandemic, as well as working with you all and our providers to make sure that we continued operating services across this state, even when we were in our hardest of times. I also want to take a minute, Jeff, to say how much I appreciate you. As you know from other states, the departments of mental health and substance abuse services don't always enjoy such a great partnership with their fellow NAMI leaders. And I can't say enough about you and your leadership over the years. It was a great day when you came to this state. I remember my first meeting of you was down at the Centennial Mall. You were speaking, and I got to listen to you, and I was extremely impressed with your wisdom and your life story and your guidance, and you have continued to be that way. So for everyone that is part of NAMI, I hope you know what an incredible leader you have in Jeff. And then also Alisa, It is good to see you. You are the major worker behind the scenes on this day on the Hill. And I can't thank you enough. Your kindness, your consideration, and your support has meant so much to us. I wanted to take a few minutes to sort of talk about what your goal is for today and what you're calling this. You're calling it imagination, inspiration, and action. I really, really, really like that. If you look at our department and the things that we have done in partnership with you, we have imagined a different way in which to respond to the needs of Tennesseans and family members that are struggling with mental illness. We have been inspirational, and I'll talk a moment about the details of the inspiring budget that we've got this year. And then obviously taking action. And when we look at taking action, the programs that are being provided across the state are really very representative of that action. I love speaking at any of your events because when I started out, as Jeff said, I came from the bottom up and literally worked on the streets of Memphis with individuals that were homeless and dealing with mental health and substance use issues. I was funded through the PATH grant, which is a federal grant that helps individuals transitioning from homelessness that are dealing with mental illness and substance use issues. And I was so fortunate when I started my career in meeting an incredible NAMI mommy by the name of Helen Adamo. And Helen Adamo was very, very strong about the fact that we needed to shift how we dealt with individuals that were dealing with mental health issues and might come in contact with the criminal justice system. She's really the person that started the CIT intervention across the state with the local leader there that you guys know very well, the leader of CIT in Memphis. And I spent many hours talking with Helen and listening to her concerns about the mental health system and saying to her as a case manager, look, let me know if your people don't get what they need. This is what I do. I'll do everything I can to help. And if Helen were around today to see, and I think she's in Brownsville, but I don't think she takes part much in NAMI, but if she were involved to see the growth of this incredible system in this state, I think she would be amazed. From her day, we now have a safety net for uninsured individuals. So if any of you have family members that are struggling with mental health and don't have insurance, that is not a barrier. That is not a barrier. And it doesn't matter if the person is 1 year old to 100 years old and beyond. We have a safety net in this state that serves uninsured. And if you are interested in getting more details on that, please look on our website, the Tennessee Department of Mental Health and Substance Abuse website. It's very user-friendly, so you can get the information you need there. The other thing that I am proud to report, and if you look at national statistics, you'll also find this fascinating. In our state, when you look at average number of individuals that are hospitalized per 100,000, you will note that because of the incredible crisis system that we have across this state and the mobile teams and the 24/7 walk-in centers that have been developed over the last several years, that our hospitalization rate is lower than most states. That is amazing. What that means is when people come in and get evaluated, they're able to either go to a crisis stabilization unit, which might be much better for that person than taking away their individual rights and hospitalizing them. It is incredible to work in a state that we have those options. The other thing that I would tell you that's pretty incredible in this state is the Creating Homes initiative. Nehru Govind is our leader, and we have expanded so much housing in that area since the year 2000. Again, all of these programs are on our website, and I would really encourage you to look at them. But getting to today, I want you to know that what you say on the Hill matters. And in many instances, it matters more than what anyone else says. And the reason it does is because you have the lived experience. You are not talking from a book. You are not talking from being removed. You are talking from real, live, lived experience. And I can't say enough to you about how important you are, how important your voice is, and how important our partnership is. Because one of the things that Jeff and I have talked about over the years is the fact that if you're divided, like if the Department of Mental Health is divided against NAMI and divided against the Consumer Association and divided against our provider groups, then we don't have a strong voice. But we have really enjoyed partnership, which is why we have grown dollars exponentially over the last several years. And so what I'll do right now is tell you a little bit about what's in our budget this year. I hope it inspires you as much as it inspires us. And that you might talk to your representatives and senators about the ability to fund and to recommend these fundings. These were put forward by Governor Lee. So let's hope it gets funded. The first thing that we've asked for is a provider rate increase. This provider rate increase would allow us to increase rates for all of our providers funded through state funds. Many of our providers have not gotten any kind of increases in almost 15 and in some cases 20 years. We had originally asked for 35 million, and we're grateful for the almost 18 million that the governor has put in his budget. So this will allow us, as we struggle with the workforce shortage issue. I know many of you have seen that that's impacted things. Amanda, I'm seeing you shake your head. And you know, it's not only impacted the mental health and behavioral health system, it has impacted every system in our country. You can go into a Wendy's. I saw yesterday that Wendy's is doing a $1,200 sign-on bonus, $1,200 sign-on bonus, because they're having such a hard time getting people. You can look at Target is now saying they're going to pay in certain markets $24 an hour for certain positions. That is what all of us are struggling with. So agencies like Jeff and NAMI, it makes it hard for you to bring in great people if you don't have the resources to fund them. So we are grateful for this and hopeful it gets passed, because it'll allow us not only to recruit new individuals, but to retain them. The next one is our substance abuse clinical treatment continuum. When you guys look at the stats that I go over in the budget hearings each year, you will note that we still have a larger gap related to individuals struggling with substance addiction in this state than we do for the mental health area. And so we are pleased that the governor has put in a request for $6 million that will help us grow that service delivery system and serve more Tennesseans struggling with addiction. Along with that is the ARP program. That's the Addiction Recovery Program. That's $1 million that would provide wraparound supports to individuals struggling with addiction. Our Creating Jobs initiative, I believe that Matt Yancey's on here. That would provide us a $900,000 amount that would allow us to draw down 3-to-1 or $4-to-1 with Department of Human Services to make sure that our loved ones are able to get jobs. This is a great time to be able to get a job. If you're struggling with mental health, I mean, hey, they're open, they're available. So we're hoping to capitalize on that. I'd ask Matt or Mark, or either of you on here and want to speak to that before I move on?
You might not be able to unmute. Roger, can you check on that?
That's fine. That's fine. I'll move on. And at the end, if we can unmute them, that would be good. All right. Awesome. Thank you, Alyssa. Then the Morgan County Residential Recovery Court, that's a court that allows individuals that are struggling in the criminal justice system to have a long-term residential site to regain recovery and be able to go back into the community and go back with a long-term recovery path. And then finally, our IT positions, we did a review across the state, and our IT positions are less than any other department with our size of programming. And so we're grateful to ask for new positions there to help us with our web-based systems that we operate, like the Safety Net or TinWits. The Tennessee Gambling Fund, this is put in there, that's about 1.2 million to be able to help individuals struggling with gambling issues. Then when you turn to two other programs that are being considered with ARP funds, you will note that that is about 34 million to increase our crisis stabilization units and the continuum. And then a 6.3 million to increase and have more mobile teams across the state to do what we call Project Rural Recovery, where we would have a mobile van that would go to remote counties that are rural and be able to offer services there. We've already been doing this with Buffalo Valley and Helen Ross McNabb. We have seen great results in rural counties in that area. Finally, we've asked for the Moccasin Bend Mental Health Institute rebuild. There is a pool of money that's been set aside to do that. That is our inpatient hospital in Chattanooga, Tennessee. And that amount is 276 million. So if you add all this up, it's the largest request that's ever gone in for our department. It's right at 345 million. So what I'd like to do is stop there. I see it's 5 till 11. And I'd like to ask, thank you, Denise. And Roger, I also hope, Roger, you know how strongly I feel about you and support you. I didn't see you on here, so I did not mention you earlier. So at any rate, I would open it up for any questions that anybody has.
Hi, Commissioner. This is Alisa.
Hey.
Can you talk a little bit about the walk-in centers? I understand that 3 were requested, and what does that look like? Where might they go?
Thank you so much. We were looking at the data to inform where these might go. When we look at the data, we know that up in the Clarksville area, we have a need up there. If you look at who's coming into our hospitals from Clarksville, we also know that we have a huge need near the Murfreesboro area because of people that are coming in from there. And then if you look at sort of the upper West Tennessee area, we're aware that we have a need there. Those are the areas that we're looking at. If you look at Upper East, because of the closure of Lakeshore, we have many more CSUs per capita than we have in Middle and West. So that's why those 3 would go there. And thank you for asking, Alyssa.
Mm-hmm. Yeah.
Alisa, I'm sorry.
It's okay. And I think your camera's off.
Okay.
I'm not sure what's going on there.
It says it's disabled by the host.
No.
Oh, okay.
Okay.
Well, we can fix that. Okay, we're having some issues this morning. So Jeff would like you to talk a little bit, if you have time, and we've got time on our end, but we want to be respectful of your time as well. But could you talk about 988?
Absolutely, absolutely. I just tried it again and it won't let me turn on my camera. So I apologize for that.
I'm working for you, Commissioner. Sorry about that.
Thank you so much, Mr. Roger. So if you look at 988, this is a way in which our country's looking at taking calls from individuals and using a number that would be easier to remember when there are crisis calls. As many of you know, 988 comes out of the National Suicide Prevention Line that we have had in this state. And so Matt Yancey, Ellen Wilbur have been really the lead of the committee that I believe Jeff is on that committee as well, where we put together a very planful approach. There's still national issues going on about when it will for sure go live. But what we're clear about in this state is we will for sure collect the data. Our system's not going to change, or we're not going to have individuals that don't get the services they need or don't get answered the calls that they need. But really at this point, we're waiting to see what the data says, Alisa, related to that program and that service.
Okay, great. Jennifer Armstrong is actually from your department is going to be joining us on the 8th for a conversation on that. Yeah.
Great.
So
Great.
appreciate that. Oh, here's a good question from Andrew. COVID, remote learning, problems at home. Some kids are not in a good place. What resources are available for them? I know your department's done a lot with the school liaisons, the mental health.
We sure have. And I'm going to tell you about two major programs. One is the Children's Behavioral Health Safety Net. Please, 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 if a kid's uninsured, please know we have dollars, we have services, and these services are offered throughout the state by our community behavioral health centers, so all of our mental health centers. And then obviously two big issues and two big programs that have been rolled out, the school-based behavioral health liaisons. The governor and the legislature gave us funding last year to be able to have one in every county across the state. And then secondly, you've got the Mental Health Trust Fund that the governor has put forward, which set aside $250 million that would allow us to draw down interest and provide and promote more services. And then finally, we got an additional almost $6 million last year to be able to go ahead and start some of these very innovative, locally based community responses to kids in our state. I'll give you a couple of ideas about what's been done. So we have seen a program that has started within an emergency department. Many of you know kids go to an emergency department because the family doesn't know where else to take that youth. And so hooking up a behavioral health individual from the local mental health center to serve that kid from that area is really very innovative. Another very innovative idea that I love is actually having behavioral health clinicians in the school, in the elementary, middle, and high school areas where a kid could go in and just talk to someone. So those are the things that I would say. I know that I had called on Matt earlier, but I see him now. So Matt, anything you want to add to that?
Well, good morning, Commissioner, and good morning, Alisa, Jeff, Roger, and the NAMI family. Only thing I would add is that in addition to all the programs the Commissioner just referenced related to children in schools, our data really supports that young adults have been dramatically impacted over the past couple of years with behavioral health issues. So we are continuing to support providers around the state in engaging young adults, specifically young adults who are experiencing their first break of psychosis. We have several first episode psychosis programs that we continue to fund through our block grant. The other thing that I will say that's relevant to young adults is that we have expanded our collegiate recovery initiative. Some of you probably heard about this in our last Planning and Policy Council meeting, but we have a director, Nathan Payne, who is working with colleges and universities across Tennessee to help stand up recovery support programs on college campuses. Again, an effort to better support young adults. So Commissioner, those are two things that I was going to add that you didn't mention, but we're doing a lot of important work related to children, youth, young adults, and families.
Absolutely. Thank you so much, Matt.
Commissioner, if I could, I put something in the chat too when my mic was off. I wanted to say something to you. or about you for folks to recognize that the commissioners also helped to bring a lot of COVID relief money into Tennessee. And she mentioned that related to the walk-in centers, the new walk-in centers or CSUs. But also I put in the chat, we are in May going to be doing some training for 911 dispatch because of the department contracting with us with some of this COVID money. And also that, can you say why you've been supporting CIT? Because you've been very generous with that as well to us.
Absolutely. As I said earlier, I was in Memphis when they were beginning CIT with Helen Adamo, and I support it because it works. It makes sense. If you train police officers and first responders who are going many times to situations that if they don't know about mental health issues, then their response would not be the same kind of response for those that do. And it's been shown that by using CIT interventions, you can really avert death and injury to many of the people that we love. I mean, that's why I support it. And as you know, Jeff, really support y'all's leadership in that area as well. So
Thank you.
Jeff,
Yeah.
if you're okay, I'm supposed to get on another call. So if it's all right, I'd like to just say to everyone, thank you. Thanks for what you do. I really hope your day on the Hill is awesome. I hope you continue to inspire all individuals through your imagination and through your action. And again, appreciate each of you and hope you have a blessed day.
Thank you, Commissioner. Thank you so much for being here. We appreciate your time.
Absolutely. Thank you.
Great. So the commissioner mentioned the Day on the Hill, and this speaks to outreach to legislators. We are going to have a couple legislators join us tomorrow, but if you would like to meet with your local legislator, I'm going to be setting up appointments over the next 3 weeks as part of our advocacy series for March. So I'm going to type in my email address, LaPolt@namitn.org, and I will work with you to get an appointment with your legislator. It can be online, or if you're in Nashville, I will go with you. And if you want to get on a Zoom call with a legislator, I could set that up for us, and I'll be there with you. And Bill Dobbins, I'm not sure, I saw Bill earlier. Bill is our lobbyist, and so we can involve him as well, because he's down at the Capitol and talk with legislators about the bills that we're looking at. We track about 30 bills or so, 30 to 50 bills each year. And now would be a good time to talk about our legislative agenda. We're going to have a 5-minute break, but I wanted to hear from the commissioner. I'm sure many of you all did too. So we're going to go ahead and work through our break, and because we need to get into a discussion about an action item that's going on at the Capitol. We at NAMI Tennessee are part of a larger coalition of organizations, including the Arthritis Foundation, other mental health organizations that are advocating for better and quicker access to needed medications. Okay, I'm going to put something up on my screen here. This is a bill that's actually up today in 2 committees, one in the Senate, one in the House, and it's called STEP therapy. So what happens is that when your healthcare provider, doctor, nurse practitioner, PA, psychiatrist, prescribes you a medication for your mental health condition, sometimes your insurance plan says, nope, we're not going to cover that. We're going to make you take this other medication because it's less expensive. I would like to see in the chat box here, how many of you have encountered that? Have you experienced a denial from your insurance, but they'll replace it with something else? My guess is a lot of people have happened. I mean, it could happen with blood pressure medicine, cholesterol medicine. But where we at NAMI are concerned about is the medications for mental health conditions, bipolar disorder, schizophrenia, depression. Yeah, see, we're seeing a lot of yeses here. Okay, well, we need your stories. And what's happening today is that the couple committees are looking at a bill that would make it easier to appeal that decision from the health plan. Okay. The health plan's position is that they will divert you to the lesser expensive, more available medication, and you have to fail first on that medication and fail a couple more times before they will approve the medication that your doctor or whomever prescribed for you. So this is why this concept or policy is called fail first or step therapy. There's like different steps you have to go through, and you have to fail on the medication before you get the one you want. Well, we have some pretty concrete thoughts about that. I'm going to share my screen so I can show you the policy paper that I've come up with and our position on this bill. So bear with me just a second. Okay, there we go. Hold on. Okay, so this is what was sent out to many of you last night, many of our allies last night, urging people to contact legislators today and throughout the week to urge them to support House Bill 677 by Representative Hall and Senate Bill 1310 by Senator Joey Hensley. So as I mentioned, some insurers use this fail first policy, and they have to go through this process, and a person has to fail first before they can get the proper medication. That makes no sense. If you're in a mental health crisis, that could be dangerous. And while some people do okay if they switch drugs, like a high blood pressure medication might not have such an effect. But when it comes to mental health conditions, the change in the structure of the medication could have a very detrimental effect on your body. So here's why we support this legislation: to make it easier to appeal the health plan. First of all, doctor knows best, or nurse practitioner, because that healthcare provider knows your medical history and how you might respond on the medication. And sometimes the consequences of switching all these medications can be devastating in terms of, I mean, there's some of the side effects could be suicidal ideation. And what we want is clear, rapid timelines outlining the request for the exceptions. In other words, we want an expedited way for you and your doctor and or nurse or psychiatrist to appeal that process. So is that something that you guys think would be beneficial? I'd like to see in the chat box. So we have washout periods between medication and weeks long before any effects seen on each medication. Right, because some of the medications, there's a ramp up time. Like antidepressants could sometimes take a couple months, 6 weeks to kick in. And then if that one doesn't work for you, or there's side effects, then you've got to start all over. And that's why this issue is so important to NAMI nationally. NAMI National is part of a coalition on this step therapy issue as well. So I would encourage you today to contact your legislators. And Roger or Kyle, if you could type in the chat box how to find your legislator. There's a place on the Tennessee Legislature General Assembly website where you can type in your address, and the names of your senator and House member will, there it is, thank you, Kyle, will pop up. And it's just very easy to send them a quick email saying that you ask them to support the step therapy legislation. We're going to get into more of this discussion tomorrow about how to reach out to legislators. And so if you want to join us tomorrow, you can do that as well. So we will get into now the other issues that NAMI Tennessee is promoting this legislative session. So the session started in January and we expect it to go through May, maybe April, depending upon how they conduct their business. We understand they want to get out quick. So I'm going to show you the document that we came up with that outlines our priorities. Now, certainly there are many, many other bills that we're watching, like I mentioned earlier. But for today, for purposes of this advocacy series, we're going to break it down and focus on just a few areas. Okay, where is my, okay. Okay, I need to get my document up for just a second. But the first issue that we're focusing on is 988, the 988 hotline, like that the commissioner and Jeff were mentioning. Jeff, can you talk, just if you're still on the call, can you talk real briefly about 988 and our approach to it as far as advocacy?
Yeah, thank you, Alisa. First of all, we think that 988 is a game changer, but it will take a little bit of time. So it was supposed to go live in July of this year, and I think that will happen. And probably the part that will work really well is the people answering the new 988 number will be on the job and they will be well trained. The issue with our advocacy is we want to be sure that those that do need treatment will receive treatment, and hopefully not with handcuffs, and hopefully not always in the regional mental health center. We would like to see a continuum of community services, which we have already, but we don't know what the impact will be with people calling 988, how many people will be showing up looking for various levels of care. We're strong proponents of community care, with walk-in centers, with even the crisis stabilization units that Commissioner mentioned. They are not as traumatic, if I can use that term, and people here can tell me from their own experience, but if you were transported to a regional mental health center versus treated in your community in more of a residential-like situation for a shorter time period, it can be better. So we want there to be access to care throughout the system and give people the care that they need earlier and make it accessible, and with or without insurance. So it'll remain to be seen how much work needs to take place to make this all happen the way we want it to happen. CIT is part of it, because while the majority of cases or crises may be dealt with through a phone call, through de-escalation, through talking it through an outpatient referral, sometimes there'll be cases involving potential for violence or danger to self or others, or threats with law enforcement needing to be dispatched. That'll be part of it. We also hear about mobile crisis, and I was very pleased to hear that Commissioner Williams says that more dollars are going to mobile crisis as well. I think I heard that right. Or she also talked about mobile treatment kind of vans that go out into local areas. But the bottom line is a well-funded continuum, not just hospitalization. People leave the hospital, community support works. I think that NAMI is so critical in this, and the part that's on set is family member education and support is also a big part of it. And someone I see in the chat, I can't see all of it now, but the word peers too. Peers being involved, family advocates being involved. A peer can let people know that things can get better, to share their story, what worked, peers are getting hired as part of crisis response and entering the system. In addition, NAMI support groups and classes can offer support to caregivers as well, because these crises, mental health crises, can be challenging, can be scary. Our caregiver classes have been shown to improve communication between a person living with a mental health condition and caregivers, and to help with problem solving. So really, we're all working together, because crisis sometimes is what brings people into treatment. Some people on their own may seek out treatment if somebody's depressed or feeling anxiety. If the symptoms they may be experiencing is causing concern, they can seek treatment on their own. But Alisa put in the chat how many people had an issue with the medicine, and if they didn't get the medicine they wanted or felt they needed right away. If I ask how many people entered treatment through the criminal justice system, I think, or knew somebody where that happened, I think it'd be a lot of people. And we hope through 988 that mental health conditions are more treated as a medical condition, and people begin treatment through seeking assistance and being diverted from jail or handcuffs and those kind of things.
Yep, thank you, Jeff. I've got my legislative priorities up on the screen. I think Jeff did a good job of explaining the 988 system and the importance. So where we're focusing our efforts as far as advocacy is what happens when you call 988, a dispatcher answers. Where does that dispatcher refer you to services? Are the services there in your community? So access to care is our top legislative priority. And what that looks like is making healthcare providers available, making the therapists, the counselors, the psychiatrists, psychologists, getting them paid so they could see more people. And so that's why we support the governor's proposal to spend close to $18 million on pay increases. And this is for those providers who in the publicly funded, the state funded facilities. Now, we would like to see even more funding available. The commissioner mentioned $30 million in her budget proposal. So we're going to ask the legislature for more money. And we'd love for you to be part of that. And also access to care is that step therapy issue, access to medications, in cutting the bureaucratic red tape that health plans often put in the way of accessing care. And then student mental health. Again, we're going to be talking about that on the 15th. So I encourage you again to sign up for our webinar on student mental health. Lots of things going on there. So we are supporting efforts to increase the number of social workers, counselors, and psychologists. Like right now, the ratio, I want to say it's like 1 social worker to 1,000 students. That number should be 1 to 250 students. And we need laws, we need policies that support our students in schools. And the second thing is, you've read in the news about the governor wanting to revamp the Better Education Program funding. That's the formula that figures out how much money school districts get. So they get money for serving a certain number of like low-income students or students with special needs, or school districts that experience a lot of growth. Like here in Nashville, everybody knows that Nashville is growing exponentially. So Nashville would stand to get more money from the state under the Better Education funding. We have been advocating for more money for student supports, and specifically mental health services. And there's a couple bills out there, a couple more have popped up. Again, we're going to be talking about that on the 15th. So we would love to have your advocacy in those areas. And I would like to stop here and see if there's any questions about our legislative agenda and where we're trying to go. Okay, how many of you would be interested in meeting virtually online with a legislator? With your legislator, or somebody in the Capitol who knows, like a legislator who needs to learn more about mental health. You can put in the chat box.
Alisa, if you don't mind, I'd be interested in knowing how many people on this call have talked to their state legislator before about their interest in mental health and to advocate for appropriate funding and that. Like, do you know your legislators, and have you talked to them in the last year?
Oh yeah, that's a great question. So in the chat box, I'd like to see how many of you have ever reached out to your state legislator, your House member, or your senator. Just put in the chat box, I have or I have not. Yeah, Denise, you and Roger are good. Jen's following a lot of bills. Amanda says not on mental health, but other healthcare issues. Yeah. So Kim, we see you. Thank you for being here. Great. Great. My state rep is an ardent supporter. Travis, I'm curious, who's your state representative? You can type that in, that'd be great. Bob Freeman, okay. Wonderful, wonderful. And is Bill Dobbins on the call? Bill is our lobbyist. For those of you who are interested, we have a 3:30 appointment tomorrow with Representative Jeremy Faison. And Representative Faison is the Republican caucus leader in the House. So he's in charge of all the Republicans in the House. So it's an easier way to put it. And it was interesting because I was at a committee meeting last week, and he sat on this particular committee that was hearing the budget presentation from the commissioner, and he was expressing support. He and many other legislators were expressing support for the pay raises for the behavioral health workers. And he shared with the group publicly that his father died by suicide. And I was able to talk with him and his wife afterwards and thank him for sharing that story. So if you would like to meet with him, he's from Newport. You don't have to be in his district to talk with him. But if you would like to be part of that meeting tomorrow, let me know. Again, I'll put my email in the chat box. We're trying to get it set up for virtual. Right now it's an in-person meeting, but I'm going to work with his staff to get that set up virtually. And so those of you who are interested, then I can send you the link to the virtual meeting tomorrow. Great. And we're getting ready to hear from our Secretary of State, Trey Hargett, who used to be a state legislator. And I was in a meeting of another organization and asked him a question about, I think it was voter registration. And when he saw that I was from NAMI, he was so excited because he loves our organization. And so I invited him to speak because he has a really good perspective on what it's like as a legislator to be lobbied or to have citizen advocates speak to you as a legislator. So we're really excited to have him here. He'll be joining us here in a few minutes. So Seema is asking, how do we get information about all the resources the commissioner was talking about? I don't think these are available in Knoxville. Seema, so the commissioner has been really open about having people reach out to her if you're having trouble getting services. In fact, she She invites it, she welcomes it, and she wants that dialogue. So what we can do is in the chat box, we can give you the website or the link to where to call for help. So this would be, Jeff, I think, would that be the safety net or the consumer services division?
Yeah, the Office of Consumer Affairs, I think it's called. I'll put it in the chat.
Okay, so, and I think somebody else had mentioned having trouble accessing services in Knoxville, and another person said that they were having trouble getting the right fit for your daughter in the right facility. And so the consumer services website is where you would want to go to get help from the department, and they'll respond. So yeah, they're very responsive.
It's actually a phone number to call, so I'm looking it up right now.
Okay, great. And while we're waiting for the secretary, let's see.
Can you hear me?
He's joined us.
I hear you. Yes, let's see if we can get your camera on. Let's see.
Well, I'm showing that mine is on.
There you
That's it.
are.
Hmm.
Hi, Mr. Secretary. Thank you for joining us. I'm going to have I'm Alisa LaPolt, the Policy
Yes,
and
ma'am.
Advocacy Director. Nice to have you here. And I'm going to have our Executive Director, Jeff Fladen, introduce you.
Great.
I missed that email.
Oh, no,
Just a couple.
I'm sorry. It's Roger. Roger,
Oh,
that was my mistake. I was wondering why Roger was chuckling. Okay, sorry. Roger's going to introduce you.
Yeah, you know how these go. You go with the flow. So thank you so much, sir. We're so glad that you joined us. Secretary Hargett was Regional Vice President for a publicly traded emergency services provider and served as Chairman of the Tennessee Regulatory Authority. He served in the Tennessee House of Representatives for a decade, representing District 97, which is Bartlett and Memphis over in West Tennessee, and was twice elected Republican leader by his colleagues. In 2009, he was elected by the Tennessee General Assembly to serve as Tennessee's 37th Secretary of State. He was reelected and is now serving in his fourth term. As CEO of the Department of State, he oversees 300 employees. He sits on 15 boards and commissions and oversees 9 divisions, including the Division of Elections and the new state-of-the-art Tennessee State Library and Archives, which is located in Nashville. His department's oversight has a wide range, from online voter registration to registrations for new businesses. A native of Ripley, Tennessee, Secretary Hargett now lives in Hendersonville with his wife, Dawn, and their 2 sons, one of which is now a freshman at the University of Tennessee in Knoxville. So glad to have you join us. Thank you for being here, sir.
Well, thank you for the kind introduction, Roger, and appreciate the opportunity to just spend a little time with y'all this morning and I'm talk about how you can best advocate for the issues that your worthy organization, seeks to, frankly, step in the gap and try and help the least of these. In many cases, people who can't advocate for themselves, and I have just a tremendous amount of respect for NAMI. And I when I was in the legislature, I served on the. I'm sorry, somebody just walked in here taking a picture and now walked out. So that was the squeaky sound. I served on the Committee on Health and Human Resources, but I also for a time served on the Mental Health Subcommittee. And so, I got to know many people with this organization and have developed those relationships for many years. And the big lesson I have learned, not just on this issue, but so many others, but if you're talking about big business, you've got the chambers of commerce and you've got all kinds of business lobbyists out there who are advocating on their behalf. If you're talking about insurance companies, you've got a lot of high power lobbyists out there that, and these large insurance companies can advocate on their behalf. But the most passionate advocates for any cause are the people closest to home, who are the ones most affected by the issues that citizens are facing. And so no one can advocate on behalf of the mentally ill, not just from your organization, but also those whose lives have been directly touched by mental illness. And so to that end, if you're the most effective lobbyist, as great as the people you have with the organization are, who are so well thought of here on Capitol Hill, it takes people from home. It takes people from home who are willing to reach out to their legislators and develop those relationships. And so, there's still a lady who I still think of 25 years later after my first term in the legislature, serving in the mental health subcommittee, a lady named Mary Scott down in Memphis, Tennessee. I could actually just about walk you to her house in her neighborhood, and who was always so passionate about being willing to reach out to me and share with me about some of the issues that people in the mentally ill community were facing, and urging me to be an advocate and listen. And she did so not just whenever there was a certain bill that was for the legislature, not just when there was a critical issue that she was facing, but she made sure that she kept that relationship going throughout the year and throughout my tenure. There's an old expression, when's the best time to plant a shade tree? Well, the best time to plant a shade tree was 20 years ago. When's the next best time? Today. And so, what people need to be doing is reach out to your legislators and offer to get together and talk to them and tell them how you've been affected by mental illness, and develop that relationship now, so that whenever they have bills that are coming before them, or there are issues that they're facing, or they're trying to figure out how to appropriate the typically scarce state tax revenues, that they can do so well informed and know how those issues are affecting you and also affect all their constituents. Because, what I have found, especially when it comes to mental health, mental illness, it affects a whole lot more people than we can possibly imagine. Because for every, and I'm making this number up, so this is not to be quoted, but for every one person that's affected by it, I can only imagine there are thousands more who are silent, who for whatever reason don't come forward and tell people about what they're facing. They're even scared to go to their family and talk about the issues that they're facing. And so, unfortunately, a lot of the things that you're dealing with, people quite often kind of feel like they hide in the shadows and maybe hide in the darkness and are scared to talk about those issues themselves. That's what makes it that much more important that organizations like NAMI exist here to advocate for people who sometimes are not able to advocate for themselves, but frankly, they are scared or ashamed to advocate for themselves. And that's one of the things we've got to do too, is take away the stigma, where people feel like they can't talk about it, where they don't know where to go get help. And I think one of the things you're going to see, and I just got to really give a shout out to Speaker Cameron Sexton and a lot of other members in the legislature, I think you're going to see a really big, even bigger push than what we've seen in recent years about making sure we can do what we can to not just focus on the physical health of Tennesseans, but how do we focus on the mental health of Tennesseans, and not just when it's just really acute at that point of impact, but also to be able to figure out how do we set up a transition for people who that moment when they may be first placed in a facility, to how do we help people transition back into a way of life that helps them feel like they are a strong, productive member of society, and not always either really, maybe really bad off and not in a good headspace to them feeling good. I mean, we got to figure out transition for people. We got to figure out there's some people who they're going to always need services. And that's just a fact of life. And so we can't overlook that. And I think you're going to see some things come forward, hopefully in the next couple of months here, where you're going to see even a greater focus than maybe even the governor and the legislature has done on that in the past. I think if nothing else, I think COVID, while there are so many negative things that happen, I think COVID's also taught us a lot of things about how we have to be able to look out for one another. And I think everybody, every legislator, House and Senate, we all have stories about the ways that we and our families and those around us, whether it's church, other social circles, where we know people have been impacted by this. So we've got to get this right. And the time has come, and nobody can help do that better than NAMI and the people who are members of NAMI. And also, if you can, in your spheres of influence, extend those back in your local communities to help others understand the issues that we're facing, they can help be advocates for the legislature as well. I would just want to make sure you understand what I'm saying is that no one can advocate for your cause like you. And as you look in the legislative session, there are so many different competing interests for time and dollars here. And if you're not speaking up, then someone else is speaking up and they're getting the value of that time and those dollars in the state budget. So you have to be willing to do that. And I applaud you for being willing to take the time to do that. Our office is certainly always a resource for people that if you're trying to figure out how to navigate something to do that. But I want to reiterate, if you're trying to reach Representative John Doe, and I may be good friends with him, but if you live in that area, you have a better shot at reaching Representative Doe because you vote for them. And also make sure that what the issues that you care about, and make sure that they know you're a registered voter and that you want to be a resource for them. A lot of times I see advocates say, well, if you don't do what I want you to do, I'm going to vote against you. Well, I'm going to tell you, this place is filled with type A personalities that you really don't want to go poke a finger in the chest and tell them, you better do this or else. I don't really know too many people up here that works with. You're much better off going to people and saying, I live in your district and I want you to know what matters to me. And also, I want you to know that, we don't have the same, we don't have the political action committees. We don't have, lobbyists and, flanks of lobbyists who are walking up and down the halls every day. I want you to know when it comes to these issues that you can contact me and I will tell you or get you information that will help you make well-informed decisions. So offer to be a resource, because what I would want, and what I did when I was in the legislature was I wanted, whenever I read a bill on an issue I didn't know a lot about, it's one thing to have a lobbyist come in the door and talk to me. I think that's great, but it was always great for me to think about somebody in that field who I knew was affected by those issues, to be able to call them back home and say, hey, I've got this piece of legislation. I'm trying to figure it out. I really want to figure out what the real life impact is back home. And if you can develop that kind of relationship, you can accomplish a lot of great things, and you'll have long, fruitful relationships in the legislature. And I've even seen times where some legislators didn't have that same kind of relationship, and they'd be trying to make a decision, and I would be able to say to them, well, you may not have talked about it back home, but I've talked to somebody back home and here's what they think. And it was able to influence other people, even though they didn't have somebody in their district who reached out to them. So you can really have a great multiplier effect by just setting up that relationship, offering to be a resource. Don't be threatening, and make sure they know that you are a registered voter and these are the issues that are near and dear to your heart. So, Alyssa, I'll be glad to try and take questions if anybody has any. If there's something you feel like I've left out, be glad to try and go back and cover something.
Oh, sure. So one question I have is, can you talk a bit about what your department has done to get people registered to vote, and talk about the Go Vote Tennessee? I'm going to put it in the chat box.
If I was supposed to have done that, I apologize. But we have a program. We have a program right now called the Your Vote Matters program, and Alyssa just put up our online voter registration website. I see that in the chat feature. Tennessee ranks among the bottom 10 states when it comes to voter registration, voter participation, and I'm a firm believer that as Tennesseans, in order to make our form of government work, and as Americans, in order to make our form of government work, we have to be engaged citizens, and the most fundamental way to do that is by being registered to vote. So we have an online voter registration system where people can go and register to vote, or they can update their voter registration address. And also we have a Go Vote 10 app that allows people to see what's going to be on their ballot in the upcoming election, find out where early voting sites are, find out where their election day site is, find out hours of operation. So we're pushing that information out so that people can have good trusted sources to get information from. One of the things we saw during the 2020 presidential election, the 2016 presidential elections, is a lot of people are getting their information from bad sources. You know, they tend to trust someone who has a kitten for a profile pic and 79 followers instead of actually getting their information from elected officials and election officials. So we want to be a good trusted source of information. It's never been easier to register to vote in the state of Tennessee than it is right now, thanks to our online voter registration system. So please feel free to take that information, use it yourself, and pass it on to others. Because if all of us as registered voters, if every registered voter in this state would just, if every 1 out of 3 registered voters in the state just registered one more person, we would go from the bottom 10 in the country to the top 10 in the country overnight. So hope that people will get other people registered, because that's also how you make your voice heard, and that multiplier effect I had earlier by getting more and more people who care about your issues registered to vote and engaged in the process.
Great, thank you. And also, from what I understand, your office can partner with organizations for a voter registration initiative. Is that right?
We can, Alisa. Thank you for that. You know, we're traveling the state. We're also working on local election commissions that we do voter registration drives. Some of them we can even do virtually. If there's groups that you're members of, we can help get you engaged, similar to how what we've done right here. But we have traveled the state, set up voter registration tables, and to try and educate voters and help get them engaged in the process.
Great, great. I'm going to pause here and see if anybody has any questions. I do have one, because I get this quite a bit as a lobbyist and an advocate. How can I be an advocate if I don't know what the bills say and I'm not an expert in Tennessee Code Annotated?
That's a great question, Alyssa, because I mean, most of us don't pull out the Tennessee Code Annotated books or have gone to law school. I think one of the things it can do, and that's what NAMI really brings to the table, frankly, is helping everyday Tennesseans who are interested in these issues. Y'all have a way of distilling that down to let people know here's the legal impact, here's the real life impact of this legislation. And then you're able, just like we're trying to give people trusted information about elections, you're giving people trusted information about the issues that are affecting them on Capitol Hill. So I would tell citizens, listen to NAMI, listen to NAMI, and they will give you good information about how you can take that and then filter that back out to your respective legislators. Hope that's helpful.
Okay. Yes. Do you have time for one more question?
Sure. I'm good. I'm good.
Okay. So people who are trying to get their voting rights restored, how do they go about that? Are there workshops or navigators that help with that?
There is different groups out there. I know they're involved in that, but I would tell people that here's the first thing they need to do. The first thing they ought to do is they ought to contact us at the Secretary of State's office. And I believe it's 1-877-490-5979. I never dial the toll-free number. There's another number, 615-741-7956, or I'm findable. I'm very findable on my website. And contact us, and we can do some research to kind of help you figure out where you stand. Because a lot of times you may need to go back and get a piece of paperwork, to show that you paid all your fees, that you've done everything you're supposed to do to be eligible. But we can help walk you through that process. I know that some people will go hire a lawyer. I tell people, don't go pay a lawyer until you know exactly what you're trying to accomplish. And so a lot of times it's a lot easier than maybe something a lawyer would require. So once again, I'd say call us at 615-741-7956. And we've got an attorney here in our office who specializes in trying to help people navigate that process.
That's great. We appreciate that information.
Do you have time for another question?
I'm sure I'm good.
Lisa looks like it's okay. All right.
We're good. We're good.
This is going to be a little of an unusual question.
Uh-oh.
Well, we forgive me if it's a little off, but we support the governor's budget. We support we supported the commissioner's budget that she requested, which some of those things are not in the governor's budget. The governor has to balance everything, and there's many competing needs. In addition, though, I've been watching the budget hearings, and there's interest amongst certain legislators to do more around mental health. And there's certain ideas that may be on their minds, but I think that family member support is not as sexy, can I say that, as some other possible things to spend money on. How can we advocate about the importance for the caregivers that are on this call, many of them, and also people living with a mental health condition, but how do we get those voices across? What's the kind of most effective way?
For me personally, what would make an impact for me, and you're right, there is a tremendous amount of interest in mental health issues right now. I sat in a meeting last week that I was really blown away by the interest of it and pleasantly surprised by how attuned some people are to try and put more money into these needs. I know what has the greatest impact is to find families who have been directly impacted by not having the resources they needed to support their family members through those difficult times. I think that's absolutely what is critical, is people who are boots on the ground, who have firsthand experience with this and can testify to the difference that just a little bit more money would have made in their lives. And also, we know this, I believe this anyway, if we can help embolden families and empower families to help care people at home, that's a far better use of money, taxpayer dollars in the long run. And frankly, it's just the right thing to do. So we know that if we can invest a little bit in helping families early on, that helps prevent a lot of expenditures elsewhere. So I think to the ability that people could tell firsthand stories, how they've been affected, I think that's the way to go. I hope that helps.
Appreciate that. Thank you.
Sure.
It does. Thank you so much for your comments. It was great to hear from you. I know as Secretary of State, you've got a busy schedule, so we're honored to have you here with us. And we look forward to continuing a dialogue with you and, calling us as a resource.
Well, thank you, Alisa. I just want to tell those on the call, you should know this or you wouldn't be on the call. NAMI is just a powerful force here and a great source of information. Support them and don't be shy about telling others that you know who in your community that they need to get involved as well.
Thank you. We can use those comments as an infomercial or a commercial for membership. Thank you so much, Mr. Secretary.
My privilege. Y'all have a blessed day.
Thanks. Bye. So how was that? I'd love to see in the chat your thoughts. Secretary of State is like one of the top 5 most important, powerful people in the legislature, in the whole state government. So I felt inspired to know that somebody knows who we are and is supportive of our work. So yeah, if you could just put one adjective: hopeful, welcoming, warm, and encouraging. Yeah. Informative, inspired. Good. Well, that's what we're trying to do today. Inspiration and imagination. So we have a few minutes left, and apparently our poll is not going to work today, but that's okay. I would love to get comments from you on what you thought about today. You can put them in the chat box, or you can email me personally. For those of you who do have stories that you want to share around step therapy, I'm happy to stay on after this presentation ends and talk a little bit more. And for those of you who want to talk with Representative Faison tomorrow, I'm happy to stay on it as well. I'd like to see any questions. Do you have any comments, thoughts about today? Amanda says, legislators seem open to hearing us talk about our experience with mental illness. Yes, That's the thing, as I've done these events over about 20 years, that's the one thing that people are surprised about. Wow, they actually listen, and you can make a difference. Stacy, a lot of great information, great session. Great to hear that our voices matter. They do, they do.
Alisa, do you
Yes.
know how they're doing with being willing to do online? And it's not just that some people are worried about going in or wearing a mask, but we have people all over Tennessee. And
Mhm.
so there's a cost to travel and park and to get there. So how open are they to meeting over Zoom? Do you know? It probably varies.
Yeah, I mean, I meet with them because I'm in Nashville in person, but most of them seem to be open. You can request an online meeting. It's helpful if you already have a Zoom account, so you can provide them the link, so the burden's not on the office to do that, the legislator's office or their aides. Yeah. But again, if you need help making an appointment with a legislator, call on me. I can help do that. And I'm happy to sit in.
What about letters and emails and those things? Do they have impact?
Yes. And we're actually going to talk about that tomorrow in our advanced advocacy session after noon. What's starting to happen is, because of the virtual meetings, is handwritten letters are becoming more and more impactful, because legislators get tons and tons of emails, and emails are very important. The legislative aides will often count the number of emails they get for an issue and against an issue to take the temperature of the constituents. But when there's a handwritten letter, that is huge. If somebody has taken the time to sit down, write it out, put it in the mail, that makes an impact. So we're going to talk about that tomorrow as well. Great. Any other questions? I'm going to type our website in the chat box. That is where you go if you want to sign up for tomorrow's advocacy training session or the other ones coming up on 988 school-based mental health and our advocacy update toward the end of the month.
Alisa, will the same link work for all of these events, or do they have separate links?
No, we haven't quite. Technology hasn't caught up with that yet. So we are having separate registrations. I know it's a little tedious, but once you do register, you will get the link to the Zoom, the Zoom link. And just like you did today, you signed up and then the Zoom link was emailed to you.
Great. What about tomorrow? Is that the same link as today?
No, it's
As a separate registration?
Right. So, and that's Eventbrite. So if you want to Google, let's see, I can try to find let me find the Eventbrite registration real quick. Or someone on staff could type that in. I don't think I can because I'm in Eventbrite. So.
I can do it.
Okay, yeah. And again, free training for advocates. So in the last few minutes, I'd like to see in the chat box what you think is possible now that you've heard from speakers who are encouraging you to rise above the challenging times, to tell you what's possible, how your voice matters. What are you walking away from today in terms of imagination and hope for making a difference? Do you feel like your voice will be heard? You can make a difference. It's easier to talk to legislators now. It's easier than one might think. It really is, because legislators are people too. They have the same concerns about their kids. They have to mow the lawn. You know? they get colds and, you know, it's just like the rest of us. Well, thank you for being here today and joining us, taking a couple
Alisa,
hours out of your time. Yes.
if you could give me just a second, I have redone the survey very quickly and I'm putting it into the chat.
Okay. Oh, okay. Yeah. If you all could just stick around for a second.
Please, if you could just do a quick survey for us, and that would be wonderful. We have got the poll open so that you can give us some feedback about this session.
Yes, that'd be great. If you all could just click on that link and take the poll, we would appreciate it. That helps us fine tune for next year. Well, thank you, Linda. This is your first exposure to NAMI. Welcome. Pleasantly surprised at the impact. Oh, yes, our national office also does a great job with Congress, and we learn a lot of lessons from them on how to advocate at the state level. Lydia, willing to help more with the service of mental health and being a voice. Thank you. And Jeff has typed in the link for tomorrow's session. Okay, Denise is saying she's clicking on the link and can't make it work.
Works for me.
Mhm.
So I just clicked on it. I don't know the issue there.
It's working for me as well.
Okay. So
Yes.
we'll conclude the recording. If you want to, let's see, I can stop the recording.